Hi, welcome. I receive questions every day on social media regarding hormone therapies, also known as HRT, MHT, or BHRT. Many of you want to know if they're safe and effective and what forms are available. So I think it's time to break it all down for you. I will start by listing the general benefits, risks, and side effects, then go into which forms are available, which are considered the safest, and who should not consider these types of treatments at all. It's my hope that by the end of this video, you'll have most of the information you need to make an informed decision about whether the benefits outweigh the risks and whether or not this treatment is right for you. Let's start with the positives, shall we? Hormone therapy helps relieve perimenopausal and menopausal symptoms such as night sweats, heart palpitations, hot flashes, vaginal atrophy, mood changes, bladder complaints, and muscle and joint pain. It helps keep the skin and nails healthy. It helps maintain muscle mass and connective tissue so you won't have to hide your bat wings anymore. It decreases the risk for osteoporosis and heart disease, and it helps with sleep. That sounds fantastic, an absolute miracle. Unfortunately, things are never that easy. There is also a list of possible risks associated with hormone therapies. HRT can cause an increased risk of breast cancer, breast density, or abnormal mammograms, an increased risk of blood clots, and that risk rises dramatically if you smoke. A small risk of stroke. The estrogen-only treatments can cause an increased risk of endometrial cancer, an increased risk of ovarian cancer, an increased risk of gallbladder disease, an increased risk of vaginal bleeding, and an increased risk of heart attack. Now that I've covered the good and the bad, let's have a look at the ugly. The following is a list of possible side effects that can occur when using hormones. Estrogen can cause breakthrough bleeding, breast tenderness, bloating, nausea, fluid retention, indigestion, headaches, leg cramps, and dizziness. Progesterone can cause bloating, breast tenderness, depression, mood changes, acne, vaginal bleeding or discharge, abdominal pain, vomiting, diarrhea, constipation, muscle, joint, or bone pain, and drowsiness. Okay, now we've covered the good, the bad, and the ugly, but that's still not the entire picture. The degree of risk is also believed to be associated with the form of hormone replacement chosen. So let's go through all of the different types of hormone replacement from the riskiest to the safest. At the top of the list is oral HRT and includes combined and estrogen-only therapies. These are therapies taken by mouth, and they carry the highest risk for all of the problems listed earlier because they're metabolized in the liver. Next on the list is oral bioidentical hormones. BHRT is marketed as the safer version of hormone therapy because it's synthesized from plant sources and it's structurally and chemically identical to the body's own estrogen. But the fact is they're still chemically modified, and there are no large-scale studies that 100% prove that they're safer or that they carry less risks. They carry similar risks to conventional hormone replacement therapy, so they're listed at the top of the list as well. Transdermal patches are next. They are believed to carry slightly less risk because they're absorbed through the skin and bypass the liver. Creams, gels, and sprays are also believed to carry slightly less risk for the very same reason. High-dose vaginal tablets, creams, and rings are also available and are believed to carry similar risks to the transdermal patches and gels. At the very bottom of the list are low-dose vaginal creams, tablets, and rings. They are believed to carry the least risk of all the forms because their effects are localized. They are used solely to deal with vaginal atrophy and related bladder symptoms. Other important information to consider when it comes to the risks of using hormone therapies are that women who use these types of therapies under the age of 60 for short periods of time and well into postmenopause are at less risk than those who begin HRT before or soon after menopause, who use them for extended periods of time, or who are over the age of 60. There are also those women for whom hormone therapies are not recommended. If you have had or are at high risk for blood clots, female cancers, heart or liver disease, or strokes, you should not use hormones as a treatment. There is a lot of information to consider when weighing whether the benefits of hormone therapies outweigh the risks. You are all different and on your own individual paths with your own unique challenges and symptoms. Ultimately, the decision about what treatment plan is best for you is yours to make. I hope this video provided you with the information that you needed to make an informed decision about which treatment plan is best for you while you navigate your way through this often frustrating and stressful transition from perimenopause into postmenopause. If you want to see more videos like this one, subscribe. I make content on all things midlife and menopause. Thanks for watching, everyone. I will see you all in the next video. Bye for now.